Feels great to go on a walk again, guys. Walking with my kids. Can't believe we haven't done this in 2 years.
2 years? We were just here yesterday.
Huh? I don't remember that.
Well, good thing your kids are doctors and we can diagnose you.
What do you think I have?
Yeah, Dad, I think you have Alzheimer's.
Maybe we should go see a doctor. What's Alzheimer's? It's wonderful to be sitting around with you guys again. I feel like we haven't done this in 2 years.
What do you mean, Dad? We just did this yesterday.
What do you mean?
I'm so sorry to tell you this, Dad, but you have Alzheimer's.
What's Alzheimer's?
Well, unfortunately with Alzheimer's, structures in the brain change and can change the normal function of the brain. These changes include loss of connection between nerve cells, death of nerve cells, deposits of plaque, and abnormal collections of twisted proteins inside the nerve. Abundant plaque causes the death of nerve cells, which may lead to Alzheimer's and first develop in the areas of the brain that affect memory and cognitive function. Progression of AD affects areas of the brain responsible for language and reasoning.
Why me? Why did I get Alzheimer's?
Well, Dad, risk factors for you include age 65 or older, which you're older than 65 now, and cardiovascular disease, considering that you had your heart attack about a month ago. And also, there might be a family history of Alzheimer's that maybe you don't know of. And other risk factors include poor access to health care, being female, diabetes, lower socioeconomic status, and education level. Action.
Why me? Alzheimer's. Shoot. Oh, hey, it's a wonderful day, guys. Haven't done this in 2 years.
So what medications do they prescribe you, Dad?
You know, I don't know what medications they gave me.
I do, Dad. I'm the pharmacist. They gave you donepezil, which increases your level of acetylcholine, which is a neurotransmitter in the brain, which is important for memory and learning. So is Exelon. It's similar to donepezil. It helps also increase the acetylcholine levels in the brain, and it increases cognitive function. And galantamine, it helps enhance the effects of acetylcholine and may also have neuroprotective properties to protect your brain from other damage. And memantine, which is an NMDA receptor, and it regulates the activity of glutamate. And this is associated with cell damage. And memantine helps protect against your cells being damaged in your brain. And then there's a new drug that's called Namzaric. And this is a combination of two drugs together that target different parts of Alzheimer's. But you're on donepezil. So you need to take your medication.
We can help you out with that, Dad.
Could you open it for me, please?
So is Alzheimer's dementia?
Actually, Alzheimer's disease is the most common neurodegenerative disorder that causes dementia and accounts for 60 to 80% of all dementia cases. Alzheimer's affects 11% of people, old people that are 65 years or older, and have a higher incidence in Hispanics and African Americans. Actually, more women develop Alzheimer's disease than men because typically they live longer.
Thanks for the information.
Yeah,
That's
sure.
very helpful.
What are the clinical manifestations of Alzheimer's?
Well, like we've seen with Dad, memory loss is the big one. The frequent forgetfulness and confusion. Difficulty performing familiar tasks, like forgetting he cooked a meal and forgetting to serve it. Issues with language. He's been substituting inappropriate words and making the speech or what he wants to say difficult to understand. Disorientation to time and place. Getting lost on their own street, not knowing where they are, how they got there, or how to return home. decreased or poor judgment. As you can see, he's walking around with a bath towel on. Issues with abstract thinking. Can't do basic calculations or recognize numbers anymore. Misplacing things. I found the utensils in the dresser drawer the other day. Changes in his mood and behavior. He's been having a lot of rapid mood swings for no apparent reason. And there's some change in his personality. He used to be so easygoing, and now he's been angry, suspicious, or fearful. And loss of interest. He doesn't really have any interest in any of the things he used to do anymore.
Poor Dad.
Don't touch me.
Come back, Dad.
Who are you?
You remember? I'm your daughter.
I don't have a daughter.
Your other daughters?
I don't know you guys. I'm leaving.
Becoming diagnosed with Alzheimer's is a multi-step process. The first portion of this will include a thorough health history with your healthcare provider. The doctor will assess for risk factors to look for any findings of memory or cognitive impairment. The doctor will perform a mini mental status exam to test for cognitive impairment. This includes asking the patient where they are, if they know why they are there, as well as if they know the date and the time. They will also perform a short memory test by telling a patient 3 words and asking them to repeat those words later during the visit. The doctor will likely have the patient draw a clock to see if they can make enough room for all the numbers. A patient with Alzheimer's will not be able to get their spacing right, and the clock will not look correct. There are also computer cognitive tests that a doctor may have patients perform to assess their ability to solve simple puzzles and look deeper into their thought process. Additional tests will be done if the patient is not able to pass these memory and cognitive tests to determine if it is indeed Alzheimer's that is causing the impairment. The additional tests include an MRI or a CT scan of the brain. This is mainly to rule out other factors that may be causing the confusion. These scans can also detect if beta amyloid is present. This is a strong indicator that it is indeed Alzheimer's. Blood tests can also look for abnormal beta amyloid values, as well as abnormal tau values. It is important to know that beta amyloid and tau showing up in the blood is not diagnostic by itself. Another test must be also indicative of Alzheimer's. Testing the cerebral spinal fluid can also show if a person has high tau and beta amyloid values that are associated with Alzheimer's. Genetic testing can check one's genes for the Alzheimer's trait. This doesn't mean an immediate diagnosis of Alzheimer's, but it does put a person at a much higher risk of developing the disease.
Well, the doctor gave me some notes about what I should avoid.
Let's hear it.
So they said that I needed to take medications and I'm going to have trouble remembering it. So I just need someone to help me give me my medications. And I should also avoid sedatives and antihistamines and some antidepressants because, my memory is going and that could further reduce my memory. Also, I think I'm gonna not be able to drive anymore, so I guess we got to sell the car. Well, hopefully I can drive initially because I don't think it's that bad.
I really think for where you are right now, it's best to not take any risks. This is just something that you're going to have to live without, but we're here to support you.
Okay, I guess I'm in the late stages then. How about cooking? Because I know I love to cook, and the doctor said that I can't cook anymore because I might burn myself.
Yeah, it's important to stay away from heated objects because if you don't remember the stove is on one moment, you could burn yourself. We don't want you getting hurt.
Okay.
So we can cook for you, but if you want to help us cook, you can help us.
That'd mean a lot. Am I wandering, guys? Because the doctor also said that people with Alzheimer's begin to wander a lot, and that I need to get an ID tag and 24 hours assistance so that people know where I am at all times. So I guess I need to invest in a GPS device so that you guys can track me.
We'll buy you a really nice tile that you can put on your belt. It looks really neat. And it would tell us where you are at all times.
All the cool kids are wearing them these days.
All right. All right. And I guess I'm also at a risk for falls now because I'm gonna have problems with my balance and walking. But I don't think I have that many problems. Maybe I can just use a walking stick or something like that. And I guess I should also avoid loose electrical cords, slippery rugs, and trash around my house. And another thing the doctor recommended was that I should clean clutter away from my house. I guess I leave a bit of a mess. He also gave me some information for you guys too.
Oh, let's hear it. For us.
So he said, or she said that we needed to make a daily plan together, and that you guys need to be flexible just in case I have some activities and if it takes a little bit more time.
You can do that.
And I guess I gotta be more patient, and I guess you guys gotta be more patient and try not to argue with me, and try to gently remind me of my inaccuracies versus trying to force the truth on me.
We'll work on it. It might be hard, but we can get it done.
And I also guess I need some memory aids. Like I need a list of the phone numbers of the house, important phone numbers, what my daily activities are, and what I usually do during the day. I guess I do have trouble remembering that.
We can put it on a big calendar for you. Put it on the fridge or someplace you'll see it all the time. Yeah.
Also, I guess I gotta keep my house the same way as it is. As in, I shouldn't move furniture. I know I really like the feng shui and changing that, but I guess I can't do that anymore, guys. And the doctor did mention that I could go on a daily walk though, because that does help improve behavioral problems and prevents physical decline.
Perfect. Your favorite place is the park.
I love the park. I want to go to the park, but I can't remember if I've gone recently. I think it's been 2 years since I've gone.
We're here now.
You love coming to the park.
We're here now?
Yeah. So what's Dad's chance?
Well, unfortunately, Alzheimer's disease is fatal. They typically die within 4 to 6 years after diagnosis. It's the 6th leading cause of death in the United States, actually, and can't be prevented, delayed, or cured.
Oh no. So there's other ways that we can help treat Dad's Alzheimer's besides medications. We can have him do memory training, like doing puzzles, coloring, stuff like that. Have him do physical exercise. He can come to the park that he loves to come to and take walks. And just keep him active with his friends and family. I think we should keep doing that.
I think that's really important. Yeah, it's a great plan.
I think so too. Let's go tell him.